So the question is, in your first study, being in a health system was an indicator of having a higher percent of interoperability engagement. And the question is, was that within the health system or with all? So this is a great question, and in the study itself, all we know is the percent of transitions of care that the hospital had, and then for what percent of those transitions an electronic summary of care record was sent. And we don't know whether those transitions occurred within the system or outside the system. So it could be that those that have a higher percent on that particular measure are doing most of that sending within their system. Given that we found that being in a system was helpful, I suspect that's what's going on. But we unfortunately don't have a way to separate out, these are the summary of care records that were transmitted outside the system versus inside the system. And that would actually be a really helpful measure to have, because it would enable us to understand to what extent sharing is happening broadly, as was, I think, the intent behind your question.